Hi, my name is Kathy. I'm 67 years old. I drove down here with my husband from North Carolina, and I have been looking for a physician to operate on my radial keratotomy scars, and I also had, I'm saying have, I still have my right eye that has these problems. This eye has been operated on and fixed. I had astigmatism. The radial keratotomy cuts 16 of them. And I always look forward to, oh, cataracts. I can get a new lens in there and I can see. I have found out that's not the case with with all the other doctors I've seen. I have to rule out some doctors before I even go there by checking their credentials. And when you're told one has done, lots of RK patients, especially you're being told this by another physician, and he tells you, well, I might have done 20 or so, and the other doctor's telling me 90 or 100. I went there anyhow and found all this out and signed the papers. I couldn't wait, even though the papers did say, I cannot guarantee in your case that you will not have to wear glasses. And I really you kind of brush that off because you're focusing on, oh, I can see. And when I saw him, he was in such a rush. He was nice and answered my questions, I have to say that. But he was like in a hurry to get back into the operating room. And I really did not appreciate that. I wanted someone who was going to spend time with me and examine me instead of having the entire staff examining me. I wanted him to also do so. And maybe that would have happened had I continued. But after about a week or so, I decided I am not going to go through this with him. I need to check further. So I went to Duke University in North Carolina. I told them I needed somebody who knew how to work on cataracts, astigmatism, and the radial keratotomy patients. Oh yes, here's one. They work on RK patients and complicated patients. So I went and had the whole bunch of tests done again. When I finally see the doctor, I asked her, I said, how many radial keratotomy patients have you worked on? Oh, she said, maybe 2 or 3. This hardly fit the bill that I was trying to, have. Anyhow, I said, and what kind of lens am I going to get? She, oh, we're just going to do the mono lens. And I said, I need to see somebody who's done more than what you have experienced. I need somebody who's really dedicated to their job, not just let me do a quick job, another buck in my pocket. And that's how I felt. So that did not come through. I went back and I had read about Dr. Gulani before, and I thought, this guy isn't real. But I was forced to look back at him again. And I actually lost sleep over at one point deciding to go with him. So I dug a little further, read a lot about him, his credentials, his patients. I went ahead and called and I said, is this guy for real? No one else seems to be able to do what he can. Nobody's going to guarantee, and I know he's not going to guarantee, but he's going to do his best. And he's let it be known that he's working on these things and taking chances to help his patients, to give them vision. So I finally decided I'm going with him after all my research. When I got here, met by him, his staff. Of course, all the tests were done again, and everything seemed very, very thorough. During surgery, I have to say, I think most people would anticipate, you know, have some nervousness, wonder if there's going to be pain, even though he tells you no, there's not going to be pain. Are you sure? Yeah, I'm sure you're not going to have pain. It did not. And I finally tried to relax more, and I thought, God is in control here. I've prayed about this, and I am not a Jesus fanatic, but I do believe in Jesus. I do believe in God, and I do think when you ask for his help, he's going to be there for you. And so after that, I relaxed. He finished up the surgery, everything was fine. I walked out of the operating room with Dr. Gulani, saw my husband. It was wonderful. Went out to the car. I'm here from out of state. I've lived in Florida, South Florida, almost my entire life, and we decided to make a change and move north. So from North Carolina, we've got to drive back there, and that's what I'm going to do today. He's been checking my eyes on day 1 after surgery, and he's very, very pleased with the results he's seeing. He's allowing me to travel, and we are going to drive. Everything is great. I can't express to him how thankful I am that I found him, and I'm glad I took the effort, the time to find out who he really was, and thank God.